Hi, Mrs. Green. Can you help me to solve my gynecological problems, doctor? Yes, Miss Green. I am going to discuss about female health problems, or you can say women's health issue today. Watch till end to know best result ever. When it comes to women's health, gynecologists are the experts. Unlike other medical professionals, they understand the intricacies of female anatomy. They can diagnose and treat a wide range of issues related to pregnancy, childbirth and menopause that affect millions of women around the world. Gynecologists are also trained in how to help you manage your symptoms if they get worse or persist after standard treatment. In this article we will take an in-depth look at some common gynecology issues that women face, from pelvic pain to heavy menstrual bleeding, and how your doctor can help treat them. Abdominal pain. Abdominal pain can be caused by many things, including diseases of the digestive tract, inflammation of the reproductive system. The most common causes of abdominal pain are inflammation and injury to the digestive tract or reproductive organs. Pelvic pain. Pelvic pain is a common problem for women. It can be caused by many things, including stressogenic hormonal imbalances and problems with the reproductive system, such as endometriosis. Pelvic pain can be treated by gynecologists, and they have medications to help with this issue. They also offer surgery if all else fails, or if you want more permanent relief, such as hysterectomy or oophorectomy, uterus removal. Frequent urination. Frequent urination is a common problem that can be caused by bladder infections, diabetes, or other medical conditions. It could also be caused by certain medications. Pregnancy and anxiety are two additional causes of frequent urination. If you experience frequent urination after having sex, or if it occurs often at night while you're sleeping, your doctor may recommend a blood test to check for infection in the urinary tract (UTI). The most common type of UTIs are bacterial infections caused by E. coli bacteria that enter through the urethra and cause inflammation near the bladder wall, a condition called interstitial cystitis. It has no cure but can be treated with antibiotics if caught early enough before bacteria have time to spread further into your body and cause more serious issues like UTI or kidney failure. Vaginal bleeding. Vaginal bleeding can be a sign of an underlying condition, but it could also be a sign of a serious condition. It's important to know how to distinguish between the two and what you should do in each situation. A normal period is when blood comes out each month as part of your menstrual cycle, so if you don't get one on schedule you might want to call your doctor. If you have missed 2 periods in a row or feel like there are fewer days between them than usual, for example, if you miss 3 days every 2 weeks, this could also be an indication that something is wrong with your body. The difference between normal and abnormal bleeding comes down to what's causing it. If it's due solely from hormonal changes happening inside your body based on monthly cycles, which usually happen every 28 days, then this can go by unnoticed unless someone notices specifically when they look at their calendars each month. However, if there is no obvious cause for bleeding other than having unprotected sex with another person who isn't pregnant, then this could indicate something more serious, such as an infection or even cancerous growths growing inside their reproductive organs. Heavy menstrual bleeding. If you have heavy menstrual bleeding, it's important to see your gynecologist. Your doctor can look at the cause of your problem and help you treat it. Heavy menstrual bleeding is common in women who have fibroids or endometrial hyperplasia, also called endometrial growth. These conditions are very common and often require treatment by a gynecologist. Abnormal discharge. Abnormal discharge is a symptom of a gynecological problem, and it can be white, yellow, or green. Abnormal discharge is usually caused by an infection in the vagina or cervix. It's important to know that abnormal discharge can also be a sign of sexually transmitted diseases like chlamydia, a bacterial infection, or gonorrhea, a type of bacterial infection. If you have any kind of vaginal odor or itching, talk to your doctor about what may be causing it. It may turn out to be something serious like bacterial vaginosis. Very light or missed periods. If you have a very light period or miss one, it's important to speak with your doctor. Your gynecologist may want to take a sample of your blood and check for pregnancy. The doctor can also help you figure out why the flow has been so irregular. If you're concerned about missing your period, talk with your doctor about whether there are any signs that make her think that something might be wrong, such as having cramps or being sick. and what she suggests doing next. If the problem persists after taking these steps, it's time for an appointment with a gynecologist who specializes in female health issues, like me. Premenstrual syndrome, PMS. PMS is a collection of symptoms that occur in the week before menstruation. It can be caused by fluctuations in hormone levels, but there are also other causes. The most common cause of PMS is an imbalance between estrogen and progesterone, which affects how your body functions. The symptoms of PMS include mood swings, cramps and headaches, all of which happen because your body has trouble processing these hormones properly. The good news? These issues usually go away after you have your period or pregnancy, or if you're taking birth control. Breast problems. Breast pain is often a symptom of breast cancer, but it can also be caused by fibrocystic breast disease, FBD, and inflammation of the breast. Fibrocystic breasts are small lumps that form in your breasts if you have had them for a long time. They are common after menopause, but can also occur at any age, even in children. If you have fibrocystic breasts, there might be a lump or two in each one. Otherwise, you may only notice one or two tiny lumps on your chest wall. The good news is that most women with this condition will never develop cancer, because these lumps make up less than 1% of all lumps in women under 50 years old who do not have other risk factors like family history or personal history of breast cancer. Gynecologists solve female health. As gynecologists are specialized doctors who can provide medical treatment, counseling and advice to help solve female health issues. All gynecologists have the same training and qualifications as general practitioners, GP, but they specialize in the area of women's health. Gynecologists are able to diagnose and treat many common conditions affecting women such as vaginismus, pelvic inflammatory disease, PID, endometriosis. Gynecologists may also be able to identify potential complications so that you can receive early treatment before they become serious problems. Conclusion: gynecologists solve female health issues. They are the experts in this field, and they are also highly trained to help women with their reproductive systems. If you have any questions or concerns about your health, it would be best to consult with a gynecologist as soon as possible.